I welcome all of you in another panel discussion titled Enhancing the Quality of Life After Breast Cancer as part of Breast Cancer Awareness Series initiated by IHW Council, a premier institute for health awareness, advocacy, and behavioral change. The series titled Let's Bleed Pink is powered by Dr. Reddy's, and I am Dr. Behjat Moini, Senior Manager, Content Research and Forum, and I'll be moderating today's session. First of all, I would like to take this opportunity to thank all the experts who have agreed to be a part of this forum, taking out time from their busy schedules to come over and help us in this mission of spreading awareness around breast cancer. Dr. N.K. Warrier, he is a medical director and senior consultant, medical oncologist, MVR Cancer Center and Research Institute, Calicut. And we have Dr. Kripa Bajaj, consultant medical oncologist, Indo-American Hospital, Hyderabad. I welcome both of you to this very special panel discussion. I hope I'm audible.
Yeah, you are very much audible, Behjat.
Thank you. Thank you for being here and, engaging with us for this very important cause, that is breast cancer awareness. That is, this breast cancer month, October. And all of us know that it is one of the, when we talk about statistics in India, it is one of, a cancer that has the highest percentage of mortality and fatality, especially when we talk about Asian countries. Now, Dr. Warrior, am I audible? Can you hear me?
Yeah, you are very much audible.
Welcome to the panel. And first of all, I would like to come to you with my first question, because this, series is specifically around cancer care once you are diagnosed with that. But before that, I would like to know about, when we talk about self, diagnosis, and because of course, diagnosis plays a very important role when it comes to breast cancer, because the earlier it is diagnosed, the better the chances of survival and treatment is. So when we talk about diagnosis and symptoms, what would you like to tell our audience regarding that?
Yeah, we have been doing awareness programs for the last 20 years or so. Still, we get a lot of patients coming late for the diagnosis. The reason being, sometimes it is lack of awareness, sometimes it is mere fear factor in their mind, and sometimes because of the inconvenience and the cost involved in the treatment. So all these factors are playing their own role in the making the diagnosis delay. So the symptoms to look for are basically the lump in the breast, or any change in the breast, either in the form of size, shape, or the color of the skin, or sometimes when you are looking at the level of the nipple, or any discharge from the nipple, or sometimes mere pain over the axilla and the hand, or the edema of the hand, or so many symptoms. But the classical symptoms described is, one should not forget that it's about the lump in the breast. And very often the lumps are overlooked, thinking that they are temporary, or this may be related to sometimes to the relation to the periods, and sometimes even doctors are not oriented towards detecting the general physician. I mean, the general category doctors are not sometimes they are not oriented towards picking up these lumps, and also some of them have the habit of just they take some over the phone, or sometimes the routine, the family physician, they ask a mere casual talk, they will tell the doctor that I have a lump, then the doctor won't be in a position to examine the patients. So many problems right now we have making the diagnosis late. But my advice for the awareness, especially for the awareness, is the lump, discharge, any change in shape or size of the breast.
So basically any abnormality that you might notice and you need to get it checked, right? So when we talk about diagnosis, the basic, I think mammogram is something that we see mostly in Western countries. In India, we usually do not, women do not prefer going for that. So when you're going to a doctor, what can a lady, because it is a topic that is very, when we talk about Indian, mindset, there are a lot of questions and queries that keep on, going in their minds. So what can they expect once they are visiting the, oncologist? What is the protocol that is followed after
that? I'll take up that. Whenever a patient complains of a lump in the breast, one has to see whether it is related to malignancy or not. And not all lumps are malignant. So you can say about 80% of lumps in the breast are not malignant. So to do a mammogram depends upon the clinical suspicion. And also there are previously we used to classify them according to the age, sometimes according to the nature of the lump, and sometimes according to the whether they have pain or not. But none of these were found to be helpful in arriving at a diagnosis. So the dictum is right now, if the patient is at a higher risk for malignancy, then one has to go for mammogram, provided she is above 40 years, the routine X-ray mammogram. If less than that, at least a sonomammogram, followed by, if suspicion is high, then one has to go for MR mammogram. So this is how we do the investigations.
Right. Coming to you, Dr. Kripa Bajaj, you can hear us, right?
Yeah, I can hear you very well.
Yes. So when we talk about, awareness creation, and of course, how, we can enhance knowledge sharing with the patients and general population as such. When we talk about cancer, it's people seem to think that it's a disease which is, which cannot be managed as such. For many Indians, cancer means, imminent danger. That is one of the reasons why people don't go for screenings and all. And especially when we talk about cervical cancer, breast cancer, these are issues because Indian women are not very open to, discussing reproductive health and things like that. So what has been your experience in that regard,
So there is a significant increase in incidence of breast cancer, both in urban as well as rural area. Urban area, there is a different scenario. In rural area, it's a different scenario. Urban area, I don't see anyone usually neglect when they find some lump in the breast. Usually elderly people who can't, who are not having family support, they tend to neglect. But most of the people who are in the less than 60 who are having family support, they're presenting really well. Urban area, but rural area, it's a different scenario. They do neglect it. They do neglect for years. It's not unusual for us to see the patient who has lump for 1.5 year, 2 year. They do come with a stage 4 cancer. Yeah. So it's actually very important for us to detect the cancer early. Till stage 3, it's a curative cancer. But if it's a stage 4, we can't cure it, but we can do a certain treatment which can increase the lifespan of the patient. So we often educate the women. We often run a women cancer clinics. We often go to the MNCs or certain public institutions. We tend to inculcate the knowledge of vaccination. But suppose you told regarding cervical cancer, there's a good, good work can be done by increasing the vaccination rates of the adolescent women. So we tend to increase the awareness amongst the society to increase the vaccination rates for cervical cancer, for the breast as well. As sir rightly mentioned, more than 40 to 45 is a niche area, Indian scenario, usually more than 40 definitely suggested. But 40 to 45, we are not suggesting screening as of now in our institution, as well as our, even in TMH also 40 to 40, they're not suggesting screening program for women. But women who are feeling the lumps, definitely the first investigation to be done is a mammogram. If it's suspicious, we have to go further for the biopsy. So all the women, I urge all the women to undergo mammography if they find any lump in the breast.
Right. Now, coming to what we've discussed about, since I wanted to ask this question in the end, but since it specifically talked about rural and urban divide, so you think breast cancer is a lifestyle disease in that sense, because there are a lot of myths and misinformation also associated with that, because I've heard that, breast feeding in a way is good and it helps in decreasing your chances of having breast cancer. Then of course there are different information that we get to see on a daily basis. So is there a rural urban divide in that sense, and a lifestyle is an important factor when it comes to
definitely the risk factor for breast cancer? If you see the risk factors, now women are like they're very modern, they're very career oriented, they're not like so much into family planning at the very early stage of the life. You see the upper population, the incidence of breast cancer is like rampant compared to rural. Definitely rural is increasing, but you see the increase in proportion of breast cancer incidence in urban is disproportionate to the rural incidence. The reason is the cause of the incidence of breast cancer, as like rightly you mentioned, late marriages, late lactation, decrease in child reproduction. So all these things like increase in OCP usage. It's very usual in urban population to find the IVF couples. They do take a fertility treatment. So a lot of hormone injections will be given during the IVF treatment. So all these things will increase the risk of incidence of breast cancer. So definitely the lifestyle habits, obesity, smoking, alcohol also have predisposition to have a breast cancer. So all these things will increase the incidence of breast cancer urban compared to the rural. So there's a quite disproportion between the two. There's a exact division is there in the urban as well as rural, the incidence as well as the risk factors involved.
Now, since Dr. Warrior also talked about the different stages of breast cancer. When we talk about, since this session is specifically titled about your palliative care and about once you have the surgery, what are the kinds of precautions that you have to take. So is surgery the last resort when it comes to breast cancer, or there are other, when we talk about chemo and other medical interventions that can also play a very significant role as such?
So usually there are 4 types of breast cancer. What we suggest, it's a hormone receptor positive, HER2 positive, triple negative, triple positive. So each one will have a separate kind of treatment. And for all the 4 types of breast cancer, chemotherapy, surgery, radiation will play a common role. Each step is very crucial to prevent the recurrence of breast cancer, not just curing it, to prevent the further recurrence of breast cancer. Once the patient got treated with these 3 modalities, the chance of recurrence of breast cancer is less. Depending on the type of the breast cancer, we do add certain targeted therapy, hormone therapy in the form of tablets and injections to enhance the survival, to improve the disease-free survival for a patient. So each modality will play equal role in the treatment of the breast cancer. Definitely surgery is a definite indication, because we do come across a patient coming, I got a complete response to chemotherapy and target therapy. Is it really required to undergo surgery like that? But definitely every person should undergo surgery. There is no ruling out the surgery option when even you got a very good response to chemotherapy. Certain cases we can avoid chemotherapy for sure, like very early cancer where it's a hormone receptor positive, we do avoid the chemotherapy, but that chance will be really less, like less than 10% of the cases.
Because chemo has its own side effects.
Yes.
Right. Dr. Warrior, coming back to you, since when we talk about breast cancer, we basically, it's almost, there's a myth that is connected that it can only affect women as such. Men are not, affected by that. But, what is your take on that?
Yeah, it's more common in women. The ratio, if you compare the ratio, it's about 90:1. 90 women is to 1 male. But of late, we are seeing more men, probably because of the referral bias. I'm sitting in a large tertiary cancer center here. So I will be getting more cases. That could be the reason. But still, I feel that because of the early detection of breast cancer, men are more aware of that, and they have more access to the medical facilities. All could be contributing. So the incidence is slightly high compared to the last decade, and the ratio is about 90 to 100 is to 1. That is the ratio.
Since you've said that it's increasing now in men also, you think lifestyle change is a major factor in that increase?
Definitely, but if you in the strict sense, the breast cancer is not a lifestyle disease, but it is hormonal hormones, female hormone related, and the more the female the fluctuations in the hormonal levels in the women of their sexual reproductive age, more will be their chance to get breast cancer. Say, for example, I'll tell you one interesting thing. Earlier, it used to be 15 years or 14 years for a girl to attain menarche. Right now, our girls are attaining menarche at much earlier age, like 9 years or 8 years. And there you are getting, and menopause used to be around 45 years. Now it is extending beyond 55 years. So you are, the average Indian woman is exposed to 7 years of extra before the usual menarche age, and about 10 years of the postmenopausal, that there is an extension of 10 years in that line also. So altogether 17 years of extra hormonal fluctuating years for added to every woman. So that is the main reason for what you see the surge in breast cancer incidence.
Dr. Kripa Bajaj, coming back to you, since we've talked about surgery, then you think counseling also plays a major role in that, because post-surgery, you would be needing to, interact with, you might have, because when you have physical transformation, sometimes the surgery can bring, a lot of negativity, mental health issues. So you think, do you see a role of counseling post-surgery?
Definitely,
in cases of breast cancer?
Definitely, there's significant role of counseling post mastectomy in the patient, even post breast conservation also. Like, some people do have their myths. The most common problem what we see, especially in low middle class or middle class women, is when they undergo mastectomy, like they're having a lot of inhibitions to go. I mean, not even just any class. Like, if they undergo mastectomy without any enhancement, like usually we suggest option of like using a mastectomy brass. During the surgery itself, there is option of reconstruction to simulate the shape of a breast. So if they are not undergoing that, it's a very difficult for a woman to go to any function, for any social gathering also. They do have this significant problem, like can we attend, we can't attend any function. I'm having so-and-so relative's marriage now, like, can I go now? And also they're abandoned by the, men. It's very usual for us when we see the lower state of the population. They have a significant social issue that men are like not, liking the women like what it was before. So all these things are there. They used to cry. I mean, because of this, the emotional health is significantly hampered. So we used to sit with the couple, like both husband as well as wife, to complement each other's problems and to each other's solution, like so how to come out of it. So we do have a session of separate 20-minute session post mastectomy to enhance the mental health and to improve the support within the family for the patient.
Talking about, since I've talked about counseling, and you think support groups, of people who have already gone through that phase in life, patient solidarity groups, these kind of things can go, a long way in ensuring the proper kind of support is, provided to a person after this kind of a surgery.
Yes. So it's a known fact that We Care Our Women Cancer initiative, which was like started by the women who got affected with the breast cancer. So there are a lot of women oncologist support groups across the India. I saw in Bombay, I saw in like Delhi, like in our hospital, we just have started that. So all of the whoever are the breast cancer survivors or cervical cancer survivors, like who received radiation before, so they have a sexual problem, they have a social stigmas and all. We do ask them to discuss with them in person, because patient to patient interaction is different compared to the doctor to patient interaction. So we ask them to elicit the sensitive issues by the cancer survivor. So later they'll bring the issue to us, and later we'll one-to-one interaction with the patient will be there with the doctor. So it's always the patient will open with the patient better than a doctor, patient with a doctor. So that's how like we created a support group of the breast cancer survivors to enhance the mental health of a patient. It's very important, as you rightly mentioned.
Right. Dr. Warrior, coming back to you, since you've talked about, surgery or chemo, so once post cancer treatment, what are the important things, do's and don'ts that a patient, because it is sometimes it can, reoccur as such. So what are the do's and don'ts, things that you would advise a patient who has, gone through that cycle? What are the precautions that he needs to, keep in mind, and things, any general kind of thing that you would, tell them on a daily basis?
Yeah, it's a very common perception is if they do hard work, then there is a chance that they might get the disease come back or a recurrence. So majority of our patients are worried about disease recurrence, and they are worried about the lifestyle changes which would have caused the disease, and they are still afraid of these about these lifestyle changes. Whatever we say, they are afraid of doing certain things and so on. But by and large, the only probably one factor which has some scientific evidence is gaining weight. So after the treatment, we generally tell them not to gain weight, do not overeat, and be physically active so that they can control their body weight. Probably that is the only advice we can give for preventing the recurrence. Apart from that, they are more anxious about the extent of work they can do, especially on the side using the hand on the side of the surgery or the radiation. So they are worried about the lymphedema, the swelling of the arm when they exert more, and what all physical activities they can do and they are not supposed to do. So what we tell them is to avoid any strenuous exercise or strenuous physical activity using the hand, using the same hand. So, and also they have to be very careful not to receive any pinpricks or some, because some of these patients, they all of a sudden they become very enthusiastic and they go to they indulge in so many work which they are not accustomed previously. So doing some gardening and getting some the thorn injury all will end up in increasing lymphedema and causing cellulitis and other things. So we definitely tell them that not to do such activities. And when they do the household work, cutting vegetables and other things, they tend to cut or cause any injury to the arm. So they have to avoid all these injuries. That is about the lymphedema. And the third thing is about getting some unusual activities, getting into some unusual activities, and they are prone for infections. And to avoid infection, especially immediately after the chemo and immediately after the treatment, we tell them not to cause any chances or occasions for getting infected. So these are some of the advices we give them regarding the physical activity. But also we generally tell them that they don't have to take any complete rest, or they don't have to restrict their physical activities But only thing that they have to be a little bit careful about doing these activities. These are the some of the advices. And also we tell them that we encourage them to attend all the social functions like marriages and other things. So that is very essential for the early recovery, the early recovery of their social well-being.
Right, right. Social and mental well-being.
Mental well-being.
Very true. Now, talking about, since you specifically said that cancer is not essentially a lifestyle disease, but when we talk about breast cancer especially, I've seen women not, going out and, talking about it, that I have been a patient, because there's this thought that it is a hereditary disease, or, it can go from generation to generation. So they say that it might hamper, the prospects of marriages in the family, in their families, especially their daughters and, related family members. So do you think, is it and it is this fear that stops them from seeking medical intervention at the first step? So do you think it is true in a sense that if you are more at risk if you have it in, if it's there in your family?
Yeah, that's true. Previously, we used to say that breast cancer is not a hereditary disease, and less than 5% of breast cancers have some hereditary background. But as we get more information about the genes associated with breast cancer, like the BRCA1 and 2 and the other genes associated with breast cancer, the incidence is slightly below 25% now. So definitely all the guidelines nowadays recommend early detection of these gene abnormalities. And we never used to get any intervention, any chance for doing advising any intervention, even if at all you diagnose these genes. But now we have several options available for the treatment as well. So oncologist is compelled to do all these investigations right from the start of treatment. And the question of the social stigma associated with diagnosis of familial breast cancer is always there. But people are now more educated, and they are more aware, and we cannot postpone testing this genetic test. Right now we are testing right from the diagnosis to onwards. But we are supposed to give them a good pre and post test counseling, so that they will not end up in or they will not lose that mental well-being. So that's very, very important.
I want to add one thing to what Sir aptly covered everything. It's actually area of my interest regarding the genetic testing. I want to add one thing. See, like urban areas these days, that couples are coming. That would be, about to marry couples are coming to get genetic tests done, because it's very important now. The genetic problem is going to a preventive phase. So I do have like a 4 to 5 couples with our hospital now, and the family is having significant history of breast and ovarian cancer syndromes. Usually these two go together. Braka sir just now mentioned, usually family will either have a ovarian cancer or like breast cancer in the family. So when it is there, the educated couples are coming forward to get the test done. Even if though the patient is like, the person is not having the breast cancer diagnosis, the couple, my mother is having this history, can you please get tested done? So whenever couple is like got detected positive, the female got detected positive, male got detected positive, we are suggesting them to undergo IVF.
Right.
So the embryos can be selected, whichever embryo is negative for genetic test, that can be raised to a kid in future. So the next generation will be free of any genetic abnormality. Now the significant increase in awareness is there, at least in Hyderabad and Bombay. So things are going in a preventive way. That's actually a good thing to look forward.
Right. We are going in a preventive mode in that sense.
Yeah.
Right. And I think awareness creation is an important, aspect of that. It plays a very important role when it comes to any other, Dr. Kripa Bajaj, you would like to add any other, thing that when we talk about life after breast cancer, how can we enhance the quality of life? Of course, counseling is an important role, plays an important role. What is anything else that you would want to add at this point?
So emotional tormentation will be there. They'll have a constant fear of like having a recurrence. So whatever small lump they feel like, even though it's a post radiation changes or post surgery changes, they'll have a constant like pressure that is it a recurrence. Recurrently, people do come to get tested. I'm having a new hard like feeling in the breast, etc. So these things we have to deal, like what kind of like post surgery or post radiation we have to counsel them. What kind of changes the patient can have, so they'll not become apprehensive for every small thing. So we do strictly suggest each person to undergo self-breast examination first 6 months weekly once, later monthly once. And once in 6 months, patient has to meet a doctor. If ever any new changes are there, the patient has to come and meet doctor immediately. If no new changes are there, 6 monthly once contact is fine. We'll examine them, and yearly once mammogram we do suggest to the patient. Apart from that, there is no need of doing any recurrent PET CTs like it's usual for us to see every 3 months, like patient will undergo PET CT and come back to us with a report, which is absolutely fine, which is absolutely normal actually. So there is no such things to be done, and these things have to be handled by clinician. He has to like he or she has to counsel properly. And second thing is regarding the mastectomy, which I have mentioned. Post mastectomy, the people are like having a lot of stigma regarding the social factors, be it a sexual factor, like or be it attending some functions. There are a lot of options are there. Please discuss with an oncologist nearby or women's support group nearby who are unaffordable also. There is a Indian Cancer Society is providing the mastectomy, like post mastectomy bras or whatever process are there. Mastectomy project emulate the simulate the breast shape actually. So these options are available. You please meet your oncologist. They'll suggest the options to you, and absolutely like it will be fine. There is no absolute difference at all, like pre and post mastectomy, like if you wear such things processes. And second thing, like you have to participate in a counseling with the oncologist as well as support group with your partner, so that the kind of social support he has to men are insensitive, like I'm sure that Dr. Warrior will disagree with me, but men are insensitive. They'll not understand the the sensitive aspects of the female, the emotional support they may not give you. They may take it lightly. So the partner has to actively reinforce that it's okay, like to have like this and all. So then only the woman feels supported. It's not just mother or father. The partner should have an active role in this.
Right.
Yeah.
The partner support does play a very important role in such a situation.
Kripa, why did you assume that I will be disagreeing with you?
Because I pointed all men, sir. That's why I thought you disagree with me.
Very, very. But I do agree with you. In this, there are a lot of men who are totally insensitive to their partners' demand, their requirements, and they fail to understand their emotional issues, especially about these, especially after the mastectomy, and a lot of awareness has to be done in this regard. And I'll tell you what we have done. Very recently, we made a short film and about this insensitivity of the partner, and how to motivate a partner to avoid all these kind of issues. And so much we are doing on towards this. That is why I thought I will tell you about our activities. We do understand this kind of things.
Yeah, so just a lighter note, sir. On a lighter note, I just said that.
Right, right. So yes, that's very true. We have talked about partner support, counseling, then of course, preventive lifestyle. And so now, since you've, seen that journey of a patient's life, when we talk about government initiatives, where do you see the gaps? When we talk about awareness creation is there, then of course counseling, support groups, everything we have covered. But when it comes to the whole cancer ecosystem, do you find any gaps from the perspective of policymakers, and what are those challenges that you encounter, Dr. Kripa?
So yeah, currently we are grappling with to provide a proper treatment to the patient than like taking care of these aspects for the government, at least the policymakers at least. Just I mentioned some target therapy. Like recently, like we are just getting some funds from the government to give target therapy to the patient. So currently, the Indian policy system is grappling with to provide the adequate treatment to the all breast cancer patients than like making a policies to enhance the post-treatment mental health and whatever, like what is required, support required for the patient. But fortunately, there are some NGOs like Women Cancer Initiative, We Care Foundation, and Indian Cancer Society, which is led by like many senior oncologists. They are like providing a support groups which will enhance the mental health. But as such, government is not taking such initiative. To the Telugu states like where I am working, as well as the Maharashtra where I worked before, there was as such no initiative with the government. But there are NGOs who are really doing good work. All are led by women who already got affected with the breast cancer or cervical cancer, something or other.
Policymakers' minimum aim is to provide at least a good provide a good treatment facility for treating breast cancer. They cannot look into the ways of improving mental health of survivor, or to tackle the issues of survivor and so on. So it's for them, at least providing the treatment facility for tackling breast cancer is the most importance.
Yes, because many times people from, especially when they are economically from a certain class, there is this thing that comes up that cancer treatments, they can burn a big hole in your pockets, out of pocket expenses, even for middle class families, if something like this happens, are a big burden. But yes, we have seen that a lot has been done in health as such. And we can hope for now that we have this an indigenous cervical cancer vaccine also available. So we can hope for things to turn better. And that's anything that you would want to add as a way forward, and in the end as a takeaway for our listeners and viewers.
Yeah, there are methods of improving the quality of life. Actually, what Kripa has said is, in addition to what she has said, the discussion regarding the treatment and the shortcomings of the treatments has to be discussed with the patient in advance, so that they can take a very judged decision right from the beginning. For example, one has to offer oncoplasty techniques for before going for the surgery. So the average patient may not be knowing about all these things. So you have to discuss all the options in advance, and the advantages, and the real counseling towards this is very important. And second thing about the radiation things, there are different radiation techniques and radiation machines, so that selecting this radiation technique is also very important. And all these things has to be coordinated while planning the treatment, so that they will not have any major side effects after the treatments. Like that, even selecting the chemotherapy and the hormones. The hormones are the worst thing actually. So they all the patients who are is positive for hormone receptors will be put on hormones for at least 7 to 10 years. So this causes a lot of issues like hot flushes and other and the difficulty to cope up with their routine work. So these has to be tackled. In a very busy OP, follow-up OP, people sitting there may not be sensitive to all these questions. They will be just looking at whether this lady has any signs of recurrence, that's all, and fail to address the psychosomatic issues, the psychological well-being, and the other physical or the sexual problems. And so better awareness towards this is very important. Here we can definitely get the support groups help. As Kripa said, the support group, we have found out is they are more open during in the support group. But I'm not sure whether how many patients can utilize this facility. So this is what I think the one has to do to improve the quality of life of survivor or breast cancer.
Right. Coming back to you, Dr. Bajaj, since, Dr. Warrior very rightly pointed out that, making the patient aware of the whole process, making the whole process more patient-centric, so that he can make, empowered choices for himself is very important. Anything else that you would want to add to that, notion?
So yeah, all the options we do discuss, like as Sir rightly suggested, what the chemotherapy side effects she may get, what kind of surgeries like options available, what kind of reconstruction she can have, and what kind of radiation she can get. We all suggest to her, and it's always the situation comes the patient is unable to decide between BCS versus mastectomy. There's a strong myth that mastectomy is better than BCS to prevent the recurrence. So sometimes the BRCA they just mentioned, like the genetic conditions, it's better to undergo mastectomy than BCS. So always we have a confusion from the patient side, which one to undergo, whether BCS or mastectomy. Then we have to like sit and discuss the advantages in like non-genetic condition patients and genetic condition patients, what kind of options available to the person, and then they have to take forward. And the Sir rightly pointed out the post treatment, the hormone treatment, like a lot of issues are there. It's not as easy as we thought once it was. So patient do have a lot of breakdowns, mental breakdowns, hot flushes and all. And we can't supplement her hormones again because it's a hormone receptor. We have to block the hormones. So we used to send to psychologists, psychiatrists, and we used to give antidepressants also for them. Though especially the young women who got treated, who got blocked by the hormones, significant drastic change in their mental health is there. It's easy for us to tackle postmenopausal females to block the hormones and all, but it's a premenopausal, for suppose 36 years old female who got it with the breast cancer. When we are blocking their hormone, there's significant hampered mental health is there for her. So it's very important for her to counsel and to support her, to reinforce her.
Right, especially in younger women, it can have a drastic effect on their mental health as well as their physical, health, the changes that they undergo. So I'm sure it was a very, very thought-provoking session. Dr. Kripa Bajaj, thanks for being with us. Dr. Warrior, I'm sure our, viewers got a lot of relevant information, and this is a step that we are taking towards, towards ensuring awareness on breast cancer, and of course, playing a positive role in bringing down the numbers in the coming future. And thanks for being a part of this discussion. And that's all for today.
Thank you so much for this wonderful opportunity, this platform to spread awareness, which is a great opportunity as a healthcare provider.
Thank you, Dr. Kripa. Thank you, Dr. Warrior.